I'm going to pass the baton first to Jeremy, if you want to take it away.
Thanks, Natalie. I appreciate that. And good afternoon, Long Beach. That is our monthly membership luncheon. So if you brought your lunch with you, feel free to snack away as we get into our program. For those who don't know me, my name is Jeremy Harris, the President and CEO of the Long Beach Area Chamber of Commerce. I see a lot of familiar faces on here, both current members and I know some future members that will be joining our organization soon enough. We've got a great program this afternoon, so I don't want to take up too much time here in the beginning with any type of announcements. We'll save the announcements towards the end on future programming and what we're all doing here at the Chamber because the topic today is pretty important and one that a lot of our members and a lot of you all have certainly been asking for and have questions with. So we've got an excellent program. We want to get right into that. So with that, I'm going to turn it back over to Natalie, our Vice President of Membership, to kick off the program and take it away from here. So Natalie, it's all yours.
Thank you. Thank you so much, Jeremy. And thank you everyone for joining us. Like Jeremy said, we have a great program for you today. Please note that this event is being recorded and will be distributed to our participants as well as made available on our YouTube page. Please also make sure that you change your name to reflect your business in your title and make sure that you are on mute while you are not speaking. If anyone has any questions throughout the presentation, please utilize the chat box at the bottom of your screen and Sandy can answer them at the end. And make sure that you stick around and have a 30-second elevator pitch ready for the end and for your chance to win a dinner from 4 for Primal Alchemy. And a big thank you to our event sponsors, both Primal Alchemy and LBS Financial. Now I have the pleasure of introducing our speaker today, Sandy Wedgeworth. She is the Director of Public Health Emergency Management Division at the City of Long Beach Department of Health and Human Services. She began her career at the Long Beach Health Department in 1999. In her current role, she oversees her department's emergency response programs, including the Public Health Emergency Preparedness Program, Pandemic Influenza Program, Urban Area Security Initiative, grant projects, and risk communication. She's participated in and coordinated various disaster management and response events. She's a member of the California Department of Public Health Southern California Regional Planning Team for Public Health Emergency Responses. She also participates in several operational area emergency management planning groups. And since March 2019, she's overseen operations for COVID-19 response, including testing sites and vaccination points of dispensing. Ms. Wedgeworth has an MPA from CSU Long Beach, and we're so fortunate and happy to have you here with us today. Thank you so much again, Sandy. I'm going to stop sharing my screen and let you take over.
Great. Thank you so much for having me, everyone. I'm very honored to be here. I'm going to go ahead and I'm going to share my screen here. So let's bring this up. There we go. So I'm gonna just go through some slides quickly because I do want to be able to give everyone enough time to answer or to ask questions, and hopefully I'll have some good answers for you. These slides I'm just going to share are actually taken from the vaccine study session that was presented to our city council just last week. So I pulled the ones that were most relevant for today's discussion. So in terms of the COVID-19 vaccine, the rollout, we actually in Long Beach began our rollout back at the very end of December, and CDC is the one who set up the prioritization and establish the tiers. And I'm sure by now you've all heard about the different tiers, phase 1, the different levels within there, 1A, 1B. So it really did start off with the healthcare workers, and that was based off of the fact that they were deemed to be the most at risk for contracting the COVID-19 vaccine virus, or the COVID-19 virus. And so they got prioritization for vaccine. Given the fact that we were also in the middle of a horrendous surge in cases, nobody's questioned that. It made complete sense. And then from there, there were other sectors outside of people with the direct patient care role who were added into the prioritization. And the way it was originally set up was that vaccine allocation that was coming into Long Beach was really allocated not necessarily with the population in mind, but looking at those different sectors that were getting prioritized and the numbers within those sectors. So they looked at things like, well, how many hospitals do you have and how many healthcare workers are within those hospitals? And then they went, you know, how many firefighters do you have? And so those were how those allocations were originally set up. And so based on that, those numbers, that's the amount of vaccine that we started getting coming into Long Beach. So there in this slide just kind of shows you phase 1A was healthcare workers, also long-term care residents, which for us here in Long Beach, we partnered with the CDC set up a pharmacy program with Walgreens and CVS. So they went out and started vaccinating our long-term care residents. Not all of them though. So there's still work on our end to go back and vaccinate some of the residents that are maybe in assisted living or board and care that did not participate in that pharmacy program. And then you can see we've got phase 1B, tier 1 was ages 65 and older. Originally, it actually started at 75 and then the state expanded to 65. Emergency response, so that's where you have like your police. Our firefighters actually were part of 1A. And then food service and agriculture was phase 1B, tier 1, education and childcare as well. So here in Long Beach, we've actually, we're doing really well with our rollout in that we have gone ahead and opened all the way up through education and childcare. We've opened up our sectors. Now, that does not mean that we have vaccinated everyone. So I'll get into more of that in a little bit. So a little bit of background on the delivery process. Because we are have our own health department, we do qualify to get our own deliveries directly to us. So we are not dependent on LA County for our allocation. Our allocation is coming directly, coordinated through the state and CDC with us directly. And then what we do, once we have those numbers of, once we receive them from the state, we coordinate with our hospitals, our clinics, our pharmacies, and some of our providers. We have 29 providers currently that signed up with us to be able to help push out vaccine. And so those include like Memorial Care. So their clinics are currently vaccinating folks. We have Aviva Pharmacy, a couple of Ralph's pharmacies, and a couple of additional providers. So in all, we have 29 providers in addition to ourselves at the health department who have the ability to both store vaccine, to distribute or dispense it. So they have their own vaccinators and are able to then report back to us. And so that's been a great partnership. And okay, eventually the goal is that this vaccine will become easily available. So just like when you want to get a flu shot, you could just go to your regular Walgreens or CVS and it's just available there for you. That's eventually where they see this going. But obviously we're not there yet. It's such a scarce resource. So until there is enough vaccine where it can be easily obtained, we will continue to have limited amount of providers, and obviously the health department will be a huge, resource for getting the vaccine. In terms of the notification, the city did set up a portal, and what it allows people to do is, regardless of whether or not they're eligible now, they can go on there to get themselves on a list, and that way we have a sense of who's waiting on vaccine, who's interested, and based on what they indicate as their sector, we are able to pull from that list. So we have actually been able to successfully pull a lot of our seniors off that list, some healthcare workers, some food and agriculture, and educators, and be able to, when there's availability of vaccine and there are events where they can go to, in some cases, it may not even be with the health department. It may be at Memorial. You know, we received notification that Memorial was opening up some more spots for first doses. So we work off of that VaxLB. So we are really trying to get people as much as possible to sign up on there. That just really makes it a lot easier on our end to be able to notify them when there's availability of vaccine for them. And in terms of the dispensing infrastructure, as I mentioned, you know, we do have some private providers that do have vaccine and are able to vaccinate their patients directly. And we do have a couple of pharmacies. But the majority of the vaccines that are reaching people in Long Beach are coming through the city's health department. And currently, that is mostly happening at our mass vaccine pod locations. And pod stands for point of dispensing. It's an old term. It's been around for a while. It's a CDC acronym for point of dispensing. And it really was a structure that was built up because of anthrax. Back post 9/11, there was, you know, some white powder letters that went out, and because of that whole incident, Ameritrax, CDC was like, hey, if we ever need to do mass dispensing, we need a system. So pods in public health are something that we are very familiar with. Here in Long Beach, we do pod exercises yearly. Every year we use our flu vaccine. So anybody who's ever come through one of our flu vaccine pods will feel very comfortable and very, will feel like it's a very familiar setting when they go to the convention center, for example, or at our health department, because it's set up exactly the same way how we've set up in the past. So right now, the capacity at the convention center is 3,000. We actually anticipate this upcoming Friday, we have about a little over 3,000 that we are expected to give second doses to. But we have the ability to actually increase that to 5,000 to 6,000 a day. The reason we haven't is obviously we just don't have the vaccine to, you know, to dispense. But in terms of the infrastructure, it is there. And once we do have more vaccine and we are able to push that out, we are going to double our numbers there. And we do feel really good. The wait times are not extreme. I know we've had a couple of, when we started out one event that it was a little bit longer, but the average at our peak is like an hour wait. And most of the time it's less than that. And that's from the time you arrive to the time you leave. So it's looking good right now. And then at our health department, we see about 1,200 to 1,400 seniors, 65 and older, that come through on Saturdays. We also have a mobile clinic program that will really be rolling out more. We just used the model this past Saturday, and we did a smaller community clinic at Silverado Park, again, focusing on seniors and people of color who have been obviously have been very affected by COVID, but maybe have some you know, barriers to being able to get on VaxLB or registering for an appointment. So we worked with some community organizations to be able to reach some folks there. Eventually our mobile clinic will also be available to go to seniors or others who are just homebound, who cannot leave their home but are still in need of a vaccine. So this model is what we're already doing for mobile testing, where we do get private residents or appointments that we do for residents in their homes. We also do it for congregate settings and things like that. And then pop-up vaccine clinics that are just going to be, you know, one day they roll up and, hey, we set up in a park, and whoever's, you know, available, we'll put it on social media and people will be able to come. And those are really going to be focused on some of our more impacted communities and trying to make the vaccine as local as possible. So some of this has already started. We started, like I said, with a Saturday, we did the Silverado. Tomorrow we're going to be at a church, St. Mark's Church, focusing on the Black community. So we're looking at equity and all these different things and making sure that we are getting vaccines to our seniors and to those who need it. And right now, and based on, you know, all the different programs, we have the ability to easily do 70,000 vaccines per month, and possibly more. I think that, again, the reason why we're not doing that yet is just that vaccine is not, there isn't 70,000 vaccines available for us to give out. We use a system called PrepMod. That's going to be changing to a new system, but I'm not going to really get into all that because we're still trying to figure out what that new system is going to look like. But all of this is just to say that, you know, there are different things in place. Eventually, when there's more vaccine readily available, I think, you know, we will have more flexibility for just walk-in type of situations right now, because it's so scarce and we have a lot of concerns with, you know, thawing too much vaccine and then not using it and then having leftovers. It does cause us to have to plan a little, like just really be really tight with our planning. And so we realize that that's not ideal for people. And it's, you know, we wish we could be more flexible, but we are having to manage a lot of different things. And at the end of the day, a lot of this is driven because of the scarcity of the vaccine supply right now, which we don't, you know, we know that that will improve. And so when that does improve, it'll make things a lot easier. And so these are just some numbers. You know, we have skilled nursing facilities, a lot of 100% of our skilled nursing facilities have already received their first dose, and these numbers are actually already outdated because this was from last week. So we're doing good there. And we already talked about our mobile vaccination that's forthcoming. And so the allocation, because a lot of people ask, well, why aren't you doing more in Long Beach, and who controls that? And there's, you know, obviously a lot of players, but the main one being CDC. Obviously, they first allocate to the state. From there, the state, which is California Department of Public Health, they then take whatever the state allocation is, and then they allocate it to the local health jurisdictions. And then we, as a local health jurisdiction, most of it does end up staying with the health department because, again, we have the capacity to do the larger mass pods, but we also do share some of that allocation with the partners that I previously mentioned. And so as of, you know, last week, we were all, it was over 69,000, but now we've surpassed over 70,000 people who have received vaccine in Long Beach. We're actually, this is the, I take it back. The 69,000 was allocated, and we have received another allocation. So we now have over 70,000 vaccines allocated to Long Beach. Okay, and this is just a little bit more about how they're allocated across hospitals. As you can see there, most of the allocation did go to the health department. Right now, our focus is on second doses because everybody is due now for second doses. We started this, actually last week, we started giving out our second doses at the health department. We're there at the convention center all week doing second doses. And over the next month, we'll be primarily focusing on second doses. That being said, there are some opportunities here and there for folks to get first doses. So, so we are doing both. We're just doing more of second doses. Considerably higher percentage of the vaccine is going to second doses now than it is for first doses. And then the plan is that come March, we go back to focusing all on first doses. So this is just more of the vaccine numbers. This is what I was just talking about. So people do have to make another appointment. Although we're being a little flexible with that because we understand there's been some technical glitches. So we are trying as best we can to honor. So if people show up with their card, their little white immunization card that shows that they got their first dose from us, and based on the date they are due for their second dose, we are letting them, obviously we're letting them through and getting their second dose. Majority of the vaccine we've given out has been Moderna. We, at the beginning, when we got our allocation, majority of the vaccine we received from the state was Moderna. And then it started we started seeing the opposite where we're getting Pfizer. So now we are kind of not really even with both, it's not 50-50 split, but the last couple of weeks, the majority of the first doses have been Pfizer. And every once in a while, we do get people who are like very specific about which vaccine they want to get. It's pretty rare. Most people understand that there's not a whole lot of difference in the vaccine. They're both mRNA. They work the same way. But I actually did have somebody who was all scheduled to get their first dose. And when they realized it was Pfizer, they were like, I want Moderna. And we're like, well, we're not going to be back with Moderna for a while. And the person was like, well, I'll wait. And I was like, okay, all right. So, but that's pretty rare. That doesn't happen very often. So that's pretty much the slides that I was just kind of wanted to build some context, but I just want to be able to get right into some questions and be able to speak directly to all of you and get a sense of what you're wondering about. And yeah, so that's what I have there.
Perfect. Thank you so much, Sandy. It looks like we had some questions come through. The first two seem to be the same one. So basically asking about when can essential food workers see their vaccines. It looks like they're registered, but they're waiting. So what do you think about that?
Yeah, that's a great question. So we were able to open up the week of, I believe it was the week, let me look here. The week of the 18th, we opened up some appointments to the food sector. Now, it wasn't a lot because our the number of vaccine we had was not a whole lot. So but we wanted to open up anyways, because what that does is when more vaccine becomes available, then we could start pulling from those open sectors, because we can't. This whole thing of having people jump ahead, cut in line. So by opening it up, even though it wasn't at the amount that we had hoped and planned, we did go ahead and do that. And so now moving forward, when there's more vaccine available, those are the people that will get priority. So 65 and older, they were first, right, on that list. So we're seeing that we're getting to the point where even when we're calling people on Vaxxle B, they've already actually gotten it. So that's really good. And so we are starting to go down into like Vaxxle B and start to be able to pull. And I think that we'll start to do more of our food workers and our education sector over the next couple of weeks, because that's looking like where the new, when we're getting the first doses, we're going to already be at those levels. Since most of our seniors, it looks like have been taken care of. I mean, obviously there's still some out there and we'll continue to give them access, but the majority, it seems like, that are on the Vaxxle B. Now that doesn't mean the majority of the city, because obviously there's still people out there who, are still figuring out if they want this vaccine, if they, you know, they maybe aren't even sure how to sign up for it yet. So there's still some issues there. But the last conversation I had with the team that's looking at the list is that they've pretty much filtered out healthcare workers and seniors, and are now going to start pulling from the food sector and then education sector. So I would just say that expect to see more availability over the next month for those groups.
Perfect. And just as a reminder, if anyone has any questions, go ahead and throw them in the chat box. It looks like we have another one. It says, my staff is in 1A and some were turned away even though they had appointments and have not had any communication to make new ones. Do you have any advice for that? And then also that they have people who are having trouble getting appointments for their second dose. So any advice would be appreciated.
Yeah, so unfortunately, yeah, so I don't know if these, the staff that you're referring to, if that was at an event we did at Cabrillo, there was some confusion around, it looks like this is from Forest Lawn, about people working in mortuaries. And so I do apologize. We have clarified that with the screeners that are on site, to that mortuaries are part of the 1A. So, please feel free to email me directly, because I think we can set something up to make sure that those people are taken care of. So that was definitely, you know, I apologize for that confusion. Yeah, it was very unfortunate. And then in terms of getting second doses or getting access to the second doses, for those who got their first dose from us, now this is the part that we have to be very careful with, because some people have gotten their first doses from other jurisdictions. They've gone to Orange County, they've gone to somewhere else in LA County. We are only getting the second dose allocation for those who we gave the first dose to. So if somebody's coming back and saying, why I want to get my second dose from Long Beach, but they didn't get it from us, their first dose originally from us, it does cause us an issue, because to give them that second dose, because it's going to throw off our numbers. And now it's taking away, it's just with the scarcity of the vaccine. Like honestly, it would be so much easier for us and for everyone if we just could be like, yes, we can see anyone, but we are going to be limiting to only giving second doses to those who got their first dose with us. So I don't know if that applies in this particular, with this particular person. But again, feel free to just, oh, so it says they received their first dose from LBHD. Great. So if they're due for their second dose, and I know that this normally is not, this is not ideal for us, but because we have had some issues with PrepMod, which is the registration system that the state provided us, we are having to manually filter like thousands and thousands of names. And so if some folks are getting missed, they should look at their 28 days. So if they got Moderna, it's 28 days later. If they got Pfizer, it's 21 days later. And they should, with Moderna, like let's say they were seen on the 14th of January, then they should be coming on this Thursday to the convention center, and they should bring their card. Ideally, they should make an appointment, but what we are letting people know is that they at least have their card and they can prove that they got their first dose to work with them and let them through. So let me see here. This week for second doses. Yes. Yes. So that's, so the links that were sent out yesterday or the day before, some of those links did start working. The site crashed, and it was crashed almost half of yesterday. One of the things that we are doing though, because we had a lot of people who were sharing links and we were getting people from all over the place using our links. We had even people all the way down in San Diego coming up for vaccine, is we did have to make it so the link's disabled after a certain amount of time. So if somebody receives a link and it's disabled, then they could email back to COVID-19 vaccine at longbeach.gov to ask for a new link. And we are still seeing this, even though we ask people, don't share the link. It's going to cause it to expire. In some cases, people are sharing the links, and after so many clicks, it just does expire. So that might have been an issue. Although the site was also down yesterday. And then for those who didn't receive an email, again, COVID-19 vaccine at longbeach.gov. And I think is this Siobhan, if you even want to just email me directly with some of these things, I can work with you to figure out some of the concerns for you. So you can email me at sandy.wedgeworth@longbeach.gov. And the next question about allowing anyone from other cities to get the vaccine in Long Beach. Yes, we do allow them to get the vaccine in Long Beach if they are working in Long Beach. So if they are part of education in Long Beach or any of the sectors, but there's a connection to Long Beach, they don't necessarily have to be a resident of Long Beach. And the way the state set it up was that it was based on employment, not necessarily residency. The mayor did open it up further for Long Beach, where it could be residency and or employment. So there are people who live in other cities who have come and gotten vaccine here in Long Beach. Now, in terms of, will we open up to more cities? The way we've done with testing, it's going to depend on vaccine availability. But right now, we are with the vaccine scarcity, we are asking for proof of residency or proof of employment, one or the other. You know, that might change. We might be asked to just make it more widely available depending on circumstances. We do have a model at the convention center that is working really well, and so we may get asked to take on a couple of additional cities at some point, but that's really all going to be dependent on having enough vaccine. And I'm sorry, I don't know if I missed any questions before, Natalie.
I think you got them all. You were on it. Got to it before I could.
When do you expect us to get vaccines? We have all registered, but no openings yet. Yeah, so I think, yeah, so we'll definitely be letting you all know. And I don't know, maybe even this group, I can communicate with you, Natalie, about some updates that you maybe can share with your group.
That'd be great.
I'm going to be really honest. I don't think there's going to be a lot of first doses, certainly not at the level of what we did in January. But I think for February, because like I mentioned before, it's mostly going to be second doses. But in March, we should definitely start to see more availability and more people getting their first dose. And the way the way this works is, you know, with the second doses, it's almost like it's a mirror. So whatever we do, like in March, we're going to have to come back in April and come back with those second doses. So it's like those overlaps of first and second. One good thing that's on the horizon is a new vaccine that maybe soon will be available, and that's Johnson & Johnson. It's a different type of vaccine, so it will only require one shot versus two. So that might make things a little bit easier because right now it is a little funky with having, you know, some people have to come back in 3 weeks and some have to come back in 4 weeks. We had, you know, even yesterday, we started doing second doses, and you know, some of the things that we're experiencing is that people are sometimes thinking that I got one, I don't want a second one. And we're like, no, we really need you to come back for a second one. So, yeah. And then I did want to, I don't know if we want to get into this. I shared this with Natalie before we got on the call. just for business owners, in terms of when your employees are going to get second doses, I would just, a bit of advice is try to get them to stagger, especially if you are a small business and not maybe having everyone get their second, even their first doses, because then that'll affect their second doses. Having them stagger, because we are seeing in some cases where people, especially with a second vaccine, maybe feel sick afterwards for a day or two. And so just in terms of your businesses, we've even done that here with the city, where we've staggered people so that not everyone is getting it all on the same day. But again, that's entirely up to you. But just as a little tip, because you might have everyone calling out sick the next day saying, I can't get out of bed, or it's not that bad. But we are seeing about, 1% of people who do feel like feverish, and or 1 to 3% after the second dose. So, yeah.
Perfect. Good tip. Thank you. And I don't see any more questions coming in. So we will start with our virtual intros, everyone. For those of you who haven't joined us before, you'll have 30 seconds to tell us about yourself, about your business. And we do have to stick to the 30-second mark, so I apologize if I cut you off and I mute you. But basically, I'll just call on you and we'll go around this virtual room, and then you can say your piece and we will move on. So first, I know you were just speaking, Sandy, but do you want to kick us off?
Sure. Yeah. So I'm sorry, I was like reading the question, just in introductions.
Yeah.
So I'm Sandy Wedgeworth, Long Beach Health Department.
Perfect. And then it's moving around on me. Amanda, do you want to take us away?
Sure. Hi, Amanda Donahue, and I'm with the Long Beach Chamber, and I'm our Special Events Manager and Executive Assistant to our CEO, Jeremy Harris.
Perfect. Marilyn, your best 30 seconds.
I'm Marilyn Singer. I'm the Membership Coordinator for the Long Beach Chamber of Commerce. If you have any questions on member benefits, you can contact me. Also, if your company hasn't purchased a labor law poster, feel free to reach out to me as well. We do have human resources materials.
Awesome. How about Steve?
I am Steve Soto from Optimum Seismic. We are a seismic retrofit company. We retrofit buildings for earthquakes. We are the oldest and largest company in the state of California.
Fantastic. Pete?
Good afternoon, everybody. Pete Marsh. I own Vector Green Power, a solar contractor focusing on commercial, some residential work. Just moved to Long Beach 10 months ago, right in the midst of the pandemic. Glad to be here, and nice to meet everyone.
Thank you. Aiden?
Hi, I'm Aiden Miller with Aiden Miller CPA. I help people with their taxes and plan for the future. Thank you.
Awesome. Amber?
Hello, everyone. I'm Amber, commercial lender with Wells Fargo. I wanted to share some information on the new SBA incentives that came from the CARES Act. For any new loans closing from now until September 31st, the SBA is waiving their fees, and they will be making the first 6 payments on behalf of the customer up to $9,000 a month. There's only so much funding available, so this is first come, first serve. The loans can be used for commercial real estate, business acquisition, working capital, and so much more. So please call me with any questions.
Awesome. Brad?
Good afternoon. My name is Brad Pollock, and I'm the director of the Long Beach Small Business Development Center. And we're located on the campus of Long Beach City College, although not right now. And what the Small Business Development Center does is we offer business advising to small businesses that are getting started and to small businesses that are growing. It's a no-cost service that is offered by paid experts in their respective fields, everything from marketing to business strategizing to management to operations, and of course, a ton of work on loans and helping you get your your documents pulled together for any applications you might be in the process of applying for EIDL, PPP, or anything along those lines. So the Small Business Development Center, here to help you. Glad to be here.
Thank you. Karen?
Hi, I'm Karen Desai, Artistic Director, Producer of International City Theater, about to launch our 36th season with the virtual production. Well, I just taped it Saturday of Tony Award-winning comedy, art, and our honorary producer is the Port of Long Beach, which we're so proud to have them participate. And I put the information in the chat box and how you can join us. This is one of 5 shows that we're planning to produce one way or another this season for our community. And we just did a virtual platform for our 3rd grade school program and our summer conservatory. So we have 4 other programs we haven't yet figured out how to do virtually, but we can't wait to get back to normal, like all of us. Thank you.
Thank you. Dana?
Hi, Dana Buchanan, Primal Alchemy Catering and Provisions. We're doing some fun stuff with boxes. We just did a brunch kit that we sent out to 60 people in LA and in Plano, Texas, and they all got online, a corporation, they all got online and did brunch together. So that was pretty fun. We also have been doing boxes for nonprofit fundraisers where we deliver a couple hundred of them all over the LA area, and they get on a Zoom call together and do fundraising. And we are, and for weddings also, we are just cutting off our Valentine's, our gourmet Valentine's dinner. You have until 8 o'clock tonight to order that. Super, super high-end, nice dinner and a lot of fun add-ons. And I put my website ordering in the chat if anybody's interested. Thank you.
Thank you. Elliot? Oh, it looks like you're on mute.
All right.
There you go.
I am Elliot Walker. I'm with Beach Team Real Estate. Our brokerage is Compass, and we are here in the Long Beach area. We help people buy and sell, as you can imagine, and check us out. Give us a call. We're here to help in the area and surrounding areas. So happy to be here. My first chamber meeting, so very informative. Thank you.
Yes, thank you, Elliot, a brand new member. Thank you for joining us today. Heather?
Good afternoon, everyone. I'm Heather Summers, Senior Vice President of Marketing with LBS Financial Credit Union, and we serve individuals in the Long Beach and surrounding areas with affordable banking services and exceptional service. And while we don't offer business accounts, we do support local businesses with our Financial Wellness at Work program, which I'm sure Oscar will talk about, but we have virtual financial literacy events that we can engage your employees with. So please ask us for more information.
Thank you. And going off of that, I'll just hand it over to Oscar since she gave you a shout out.
All right. Thank you so much. Welcome. Good afternoon, Long Beach. Glad to be here. As Heather mentioned, we are with LBS Financial Credit Union. We've been serving the community since 1935, and we offer a great financial wellness program for your employees. If you're in need of reaching out to your employees and setting up, for instance, a educational webinar on budgeting, credit, things of that nature, please reach out to me. Love to be of help. Again, Oscar Velasco with LBS Financial Credit Union. Thank you.
Thank you. And Wayne?
Hi, I'm Wing from Internet Communications. We're an advertising agency targeting the Asian sector market. You might know us from Powell Long Beach, and most recently we actually launched Port City Creative Guild. So if you go by our office, you might be able to see a lot of envelopes with really famous artists' art on it, and we're trading it with local students in art classes. So yeah, go check it out. And we'll also have a Lunar New Year display soon. It is Lunar New Year this Friday. So go check that out. It's pretty exciting stuff.
Awesome, thank you. Gwen?
Good afternoon, everyone. Gwen Butterfield. I am owner of Butterfield Communications, specializing in community and government relations consulting in the 2 port areas. And here on the call today, representing my client, who's a corporate gold partner of the Chamber, Mitsubishi Cement Corporation. And hope everyone has a good day and gets their vaccine as soon as they're able.
Yes, definitely. Leslie?
Hi, I'm Leslie Smith with McCormick LA Public Relations, and I'm a PR consultant and facilitator. And I mainly help small businesses and local nonprofits. And if you happen to be the kind of person who wants to do it all yourself, I highly recommend you pick up my little book. It's only $4.99 to download a Kindle edition, and it's $10 for the printed book. It's 50 pages. Very easily to understand everything. There's no jargon, and it's a workbook as much as it's a marketing primer. So check that out, and I will put my website in the chat box, and that has a connection to buy the book. Thank you.
Thank you. Willis?
What's happening, Long Beach? My name is Willis Allen. I was born and raised here in Long Beach, so it's nice to be a part of the Chamber of Commerce now. I work at Serve First Solutions over in Los Alamitos, actually. But basically what we do is we help businesses reduce operating costs and increase profitability through payment processing solutions. So basically what that looks like is retail. Anytime you swipe your card in a portal, mail order, telephone order, and then the e-commerce space. So, you know, if you ever want me to take a look at your current merchant statement, or you just have questions about the industry in general, definitely reach out, give me a call. I'm always happy to help the Long Beach family. Happy to be here. Thanks for having me.
Thank you. And thank you for your membership, Willis, another new member. So thanks for joining the call. And Liz.
Hey, everyone. I'm Liz Crozer. I'm the Director of Development at Casa Youth Shelter, also in Los Alamitos. We are the only emergency youth shelter between Culver City and Huntington Beach. So we definitely very, very much serve Long Beach. And since the COVID outbreak, we modified a number of our services to be open and available to anyone. And so that is mental health. All of our mental health counseling is now delivered online, as well as our parenting classes. So we do more than just the amazing work we do with homeless youth. We also help families. Certainly, I know that there's just within my friends, I've had a number of parents who would love to take part of our services. So please get the word out that we're here, and we're here for everyone. Thank you.
Awesome. Thank you. Mario? Oh, it looks like you're muted again.
Okay, there? Okay. First of all, great job, Long Beach Chamber. Very informative luncheon. Mario Cordero, Executive Director of the Port of Long Beach. And as we like to say, we are the port of choice. And however we could help small business and business enterprises in Long Beach, not only do we move the cargo, but again, we do have an emphasis to working with the small business community here in Long Beach. Thank you so much.
Thank you. Jonathan?
Good afternoon, everyone. My name is Jonathan Bruckner with Cutco. Cutco, if you eat, you need Cutco, and makes a great gift as well. So I'm a brand new chamber member as well. So feel free to reach out to me. Thank you.
Yes, thank you. Another new chamber member. We love to see it. How about Stacy?
Hello, my name is Stacy Evans. I'm from Domenico's Restaurant and Catering. We're the oldest restaurant in Long Beach. We started in 1954. We are open for patio dining right now, as well as, of course, takeout. Our patio is adorable, so come down to 2nd Street. And then on another note, we are opening a new restaurant in Mission Viejo. So we're under construction, but it's on the lake in Mission Viejo, and we should be open in June. So come and see us.
Awesome. And Siobhan?
Hello, everyone. I'm Siobhan Ozinga. I'm the Vice President of Forest Lawn in Long Beach. We have been caring for families for over 100 years during the worst time of their lives. So I hope that I do not hear from any of you anytime soon. Unfortunately, right now, everything you've been seeing on the news is true, and we're overwhelmed with the number of families we are serving, I'm sad to say. But so glad to hear from Sandy today about the vaccine rollout, and I will attest to taking that day off after that second dose. I got mine through Orange County on Saturday, and thank goodness I didn't have to work on Sunday, but it's all worth it.
Thank you. And last but not least, we have Nancy. It looks like we got everyone.
Hi there, I'm Nancy Lesney with SoCal News Group and Ad Taxi. And I work with local businesses and nonprofits, helping them get the word out to the community and helping them generate some new revenue or increased in revenue. And like I said, both traditional and online marketing services. And if you have any questions, feel free to reach out to me.
Awesome. Thank you, Nancy. And I actually saved Nancy for last because she is the winner of our raffle today. She will get a dinner for 4 from Primal Alchemy. Thank you again to Primal. Yes, congratulations. And thank you again to our sponsors, Primal Alchemy and LBS Financial, for making this all possible. I am going to hand it over to my team member, Amanda Donahue, so she can tell us what the chamber has coming up.
Thanks, Natalie, and thank you all for your participation today. But before we conclude today's event, I want to update you guys on some programming that's taking place this month. We are going to be continuing our DeVry webinar series this Wednesday, well, I guess tomorrow at 10 a.m. This week we'll be discussing the time management strategies and the power of focus. That event is free to our members and $10 to our future members. And this Thursday, February 11th at 4 p.m., we'll be having our joint Thirsty Thursday networking event with the Greater San Fernando Chamber, which is actually a very fun and interactive event if you haven't joined us before, but I highly recommend you guys all join us. Next Wednesday, February 17th, we'll have a joint webinar with Optimum Seismic. That will take place at 11 a.m. with our very own Jeremy Harris as one of the panelists discussing the Resilience Advantage. And lastly, we'll have our next Good Afternoon Long Beach, let's see, Tuesday, March 9th at noon. And you can find a complete list of the webinars and events that are taking place at www.lbchamber.com/events. I've also placed it in our chat box for all of you guys to go and reference. And yeah, because there's plenty more going on. So we like to keep you guys all informed and interactive. It's hard to do these days, so we try and do it as much as possible. And that is all that I have. So thank you. I'll turn it back over to Natalie.
Thank you so much, Amanda. Yes, I saw Dana shouted out Thursday. It's so much fun. So if you can attend, please join us this Thursday, and of course at all of our other events whenever you are available. A big thank you to Sandy. Thank you so much for joining us and for all of that information. And keep your eyes out on your email. I will be sending out a recap in the next 24 hours, and it'll include all of the slides that Sandy provided, as well as a recording of this event as well. So thank you all so much for joining us.